Hi everybody, I'm Richie. I'm the Development Director here at Rainbow House. Many thanks to MU Healthcare and the School of Medicine, and a big hello to everybody at the MU Healthcare Leadership Initiative. Thanks so much for taking just a few minutes to learn more about what we do here at Rainbow House. Rainbow House was started in 1986 by our founding mother and our good friend Kathy Hughes. She started it in a great big farmhouse over on Oakland here in Columbia. And she began Rainbow House with one simple but very important mission, and that is to keep children safe. 36 years later, we have the exact same mission now. To keep children safe, we do that through prevention, assessment, and intervention in cases of child abuse and neglect, and we do that with two functions here at Rainbow House. We have the Child Advocacy Center on one side of the building. The other side of the building is the Children's Emergency Shelter. Those two functions work independently of one another. We'll take a closer look at each of them. This is the Child Advocacy Center here at Rainbow House. Our CAC follows a model created in the middle 1980s by a prosecuting attorney, then congressman named Bud Kramer in Alabama. He came to think that what we consider the old way of doing things just wasn't very friendly to the children or the families involved, because it involved them telling their story over and over in a somewhat cold, police station typically. So the idea with this model is to minimize the trauma to each child by ideally allowing them to tell their story very thoroughly one time to a skilled forensic interviewer with a team of people from that corresponding county observing it and taking notes. And then our recordings and notes from professionals can serve in court to hopefully save the child the intimidation of court testimony. This is one of the forensic interview rooms that we have here at Rainbow House. You'll notice the acoustics are somewhat different. Great efforts are made to soundproof the walls in these rooms. With the camera turned around, I can show you some of the features of the forensic interview room. In here, we do have high quality audio. You'll notice a mic there in the ceiling, as well as video cameras. Every interview is recorded with high quality audio and high quality video. As mentioned before, we use a multidisciplinary approach, and that means that observers from corresponding counties will be here to watch an interview, a forensic interview that is, as it's happening. And those are people like law enforcement, prosecuting attorneys teams, children's division is usually here, medical personnel sometimes. They're all looking at this interview while it's happening. That's the room we were just in on the screen. They see it happen in real time, and they're in here taking notes and watching for cues in the child being interviewed. And hopefully those notes of theirs and the recordings that we have can all be used in court to spare the child the intimidation of court testimony. Another service provided in the CAC are forensic exams. In this room, we do SAFEs, that's a sexual abuse forensic exam, and also child physical abuse forensic exams. This room is designed specifically for forensic exams, and of course that's the only thing that goes on. In this room, Dr. Holly Monroe comes in on an as-needed basis to perform those forensic exams for the 11 mid-Missouri counties that we serve. That's a quick look at the Child Advocacy Center. It gets a lot of traffic through here in the 11 counties we serve. In 2020, we did a total of 453 forensic interviews, and that number jumped to 565 in 2021. Now, it's important I distinguish a difference in the two sides of the building. That's the Child Advocacy Center, and then we'll go now over to take a look at the Children's Emergency Shelter. And it's important to know that the two functions work completely independently of one another. And what I mean is, the kids who are seen in the CAC, they're here to have a forensic interview done. They're coming from 11 different counties. They're with their families or caregivers, whoever it is that's bringing them in to see us for the forensic interview. And then they leave. Of course, they go back home. They don't stay here at Rainbow House. In the Children's Emergency Shelter, those are kids, most commonly kids who are staying with us temporarily. We have three types of services in the shelter. We have residential care, and that's what most of the kids in there are doing, and they're most commonly en route to a more permanent home, whether that's a more permanent foster home or residential living somewhere in the state of Missouri. It's also not uncommon at all for us to get kids who just don't have another place to go. Maybe parents have become homeless and they've made a really wise decision to bring the children here so they can have a stable and loving environment while the parents get back on their feet. We also have crisis care and respite care services in the shelter. This is the hallway rooms in the Children's Emergency Shelter. Every kid can have their own room unless they want to share, and if it's appropriate. Sometimes siblings like to share rooms. Again, the capacity for 18 kids here in this wing. This is a big playroom, and there we have a TV room, a good place to hang. Here we'll go into, I'm always quiet when I walk in this room because it is a nursery, but there are no kids, no babies in here right now, so this is just another good room to hang. That is a real quick look at everything here at Rainbow House. Please check out our website. We're at rainbowhousecolumbia.org. Our social media pages are very active, particularly on Facebook and Instagram. Stop by and see us if you're close by. If you're here in Columbia, we'd be thrilled to meet you and give you a tour. And again, thanks so much to everybody at MU Healthcare and the School of Medicine for thinking of Rainbow House with this outreach. We hope you're having a great time at the MU Healthcare Leadership Initiative. Thanks very much.